Welcome back to Studio 701. Many expectant mothers are overjoyed with what's to come, but a growing number are labeled as advanced maternal age, something I myself have been with 2 pregnancies now. In today's Well-Being, I speak with Dr. Tobiasz about what it means to be advanced maternal age for you and your baby. Thank you so much for joining us on Studio 701, Dr. Tobiasz. And the first question we have for you is, what is advanced maternal age? What does that mean?
So most of us define advanced maternal age as maternal age at the time of delivery or anticipated delivery of 35. So if a woman becomes pregnant at the age of 34 and she's due February 10th, but her birthday is February 1st, she's going to be classified as advanced maternal age.
And what are any extra risks that might be associated with that? Why is that something that professionals and doctors keep track of?
So as we get older, we do have a higher risk of pregnancy complications. And, even when you compare a pregnancy in a healthy woman at the age of 35 or 40 to when they were 25, even if they're otherwise healthy, they do have a slightly higher risk of complications. And we think about things like high blood pressure or preeclampsia. That's one of the common things that we think about as we get older. Higher risk of gestational diabetes, higher risk of delivering early. And there's also higher risk of women having twins and other pregnancy complications as well, like small babies. So the other problem with advanced maternal age is that as we get older, we tend to accumulate health concerns. So a lot of that risk is actually going to be attributed to any other underlying health concerns. So if a woman also is coming into pregnancy with diabetes or high blood pressure, her risk is going to look a lot different than, somebody that's otherwise healthy at the age of 40. So
how common is this to see moms who are advanced maternal age?
So it's becoming more and more common. So since the 80s, the number of women that are giving birth after the age of 35 has actually gone up. And every year it goes up about 1 to 2 percentage points. So the last year that they have data on this was from 2019. And about 18% of the births in the country are to women over the age of 35.
What do you say to moms who are advanced maternal age as far as helping quell any concerns they might have about a lot of those risks you just mentioned?
So first, we take a very detailed history to address any underlying health concerns that they have. So that's first and foremost. If they don't have any of those concerns, then what I generally talk about is monitoring for symptoms of things like preeclampsia. And sometimes we talk about moms being on a baby aspirin every day to help reduce the risk of preeclampsia. We talk about the different ultrasound monitoring and appointment schedules that sometimes come up. Sometimes moms that are over the age of 35 or certainly 40 are going to be coming into the office a little bit more often towards the end for more monitoring. There's usually more monitoring of the baby with growth ultrasounds over the age of 35. But again, that's going to depend on, what other health concerns are going on. So,
are there any medical benefits to waiting until you're 35 or older?
Well, so I think there are some benefits for families and women in general, and that's why a lot of people are delaying having children. We want to have, careers and jobs and other things too, and sometimes it's not very feasible to do that while also having children. So becoming more financially secure, stable, that type of a thing would be a potential benefit. From a health perspective, not necessarily, unless you have underlying health concerns that need to be addressed. So one example of that would be, let's say a woman has bad kidney disease and she needs a kidney transplant. So delaying the pregnancy till she can achieve that and is doing well would be a better thing than getting pregnant at a younger age but having all those kidney issues. So there's a lot of variables in that. It's perfectly acceptable to have a healthy pregnancy well into your 30s, even into the 40s. But kind of optimizing the rest of your health is going to be important. So if you have diabetes, make sure that's well controlled before you enter pregnancy. That's going to be much more harmful than being over the age of 35. If you have high blood pressure, be sure you're on medications that are safe to take when you're pregnant. That's the biggest thing.
Great advice. Thank you so much, Doctor.
Yep, you're so welcome.
And this has been Well-Being, and if you'd like more information, you can certainly go to sanfordhealth.org.
Coming up next, if you haven't been inside the Laughing Sun Brewery, you are really missing out.
We often talk about their craft beer, but what about their food? Jeff goes inside to taste test just a sample of what they have on the menu. That's coming up next. We hope he has wet wipes.
Join the Studio 701 conversation.